Hey, I hope you will good as always. Welcome back to our channel, where we uncover the secrets of the health science. Today, we have an intriguing question that, how does Viagra work? Well, get ready to be amazed because we have the answer for you. So, let's get started. Viagra, also known by its generic name sildenafil, is a popular medication used to treat erectile dysfunction, ED, and pulmonary arterial hypertension. In this video, we will delve into the mechanism of action of Viagra and explore its effectiveness in treating ED. So, let's answer the question, how does Viagra work? What is Viagra? Viagra, developed by Pfizer, is a medication that belongs to a class of drugs called phosphodiesterase type 5, PDE5, inhibitors. It was initially approved by the FDA in 1998 as a treatment for ED, revolutionizing the field of sexual medicine. Understanding erectile dysfunction. Before delving into how Viagra works, it is important to understand the underlying cause of erectile dysfunction. ED is a condition characterized by the inability to achieve or maintain an erection sufficient for sexual intercourse. It can be caused by various factors such as medical conditions, psychological issues, or lifestyle choices. The role of nitric oxide. To understand the mechanism of action of Viagra, we need to first explore the role of nitric oxide, NO, in the body. During sexual stimulation, the release of NO in the penis triggers the production of cyclic guanosine monophosphate, cGMP. This molecule relaxes the smooth muscles in the blood vessels, allowing them to dilate and increase blood flow to the penis. Inhibition of PDE5. Viagra works by inhibiting the enzyme phosphodiesterase type 5, PDE5. PDE5 is responsible for the degradation of cGMP, which leads to a decrease in blood flow to the penis and the subsequent loss of an erection. By inhibiting PDE5, Viagra helps maintain higher levels of cGMP, which promotes vasodilation and enhances erectile function. Enhancing blood flow. By inhibiting PDE5, Viagra ensures that the levels of cGMP remain elevated, allowing for sustained vasodilation and increased blood flow to the penis. This enhanced blood flow facilitates the achievement and maintenance of an erection during sexual stimulation. Onset of action. Viagra is typically taken orally, and its onset of action is usually within 30 to 60 minutes after ingestion. However, it is important to note that sexual arousal is necessary for the medication to work effectively. Viagra alone does not cause an erection. It simply enhances the body's natural response to sexual stimulation. Duration of effect. The duration of Viagra's effect varies from person to person but generally lasts for about 4 to 5 hours. During this time, the individual can achieve and sustain an erection when sexually aroused. It is worth mentioning that the duration may be affected by factors such as age, overall health, and dosage. Common side effects. Like any medication, Viagra can cause side effects, although not everyone experiences them. The most common side effects include headaches, flushing, indigestion, nasal congestion, and visual disturbances. It is important to consult a healthcare professional if these side effects persist or worsen. Important considerations. Before taking Viagra, it is crucial to consult with a healthcare provider, especially if you have pre-existing medical conditions or are taking other medications. Certain medications, such as nitrates, can interact with Viagra and lead to potentially dangerous effects. Viagra dosage and administration. Viagra is available in different strengths, including 25 mg, 50 mg, and 100 mg tablets. The recommended starting dose for most individuals is 50 mg, taken approximately 1 hour before sexual activity. However, dosage adjustments may be necessary based on individual response and tolerability. It is essential to follow the prescribed dosage instructions provided by your healthcare professional. Viagra and other medications. Viagra may interact with other medications, including nitrates, alpha blockers, and certain antifungal or antibiotic drugs. These interactions can lead to adverse effects or reduce the effectiveness of Viagra. It is crucial to inform your healthcare provider about all the medications you are currently taking to avoid potential complications. Here are some important questions and their answers in short for you. How long does it take for Viagra to work? The onset of action of Viagra is typically between 30 and 60 minutes after ingestion. However, it is important to note that sexual stimulation is necessary for the medication to work effectively. Can Viagra cure erectile dysfunction permanently? No, Viagra does not cure erectile dysfunction permanently. It is a temporary treatment that helps enhance erectile function during sexual stimulation. Is Viagra safe to use? Viagra is generally safe when used as directed and under the guidance of a healthcare professional. However, it may not be suitable for individuals with certain medical conditions or those taking specific medications. It is important to consult with a healthcare provider to determine if Viagra is safe for you. Can women take Viagra? Viagra is primarily indicated for the treatment of erectile dysfunction in males and has not been approved for use in females. There are other medications available for female sexual dysfunction, and it is best to consult with a healthcare provider for appropriate treatment options. What should I do if I experience side effects? If you experience any side effects from taking Viagra, it is important to consult with a healthcare professional. They can provide guidance and determine if any adjustments to your treatment plan are necessary. In conclusion, Viagra is a widely used medication for the treatment of erectile dysfunction. By inhibiting the enzyme PDE5, Viagra enhances the body's natural response to sexual stimulation, promoting blood flow to the penis and facilitating the achievement and maintenance of an erection. It is important to consult with a healthcare professional before using Viagra to ensure its safe and appropriate use. I hope you have enjoyed our video, so don't forget to hit that subscribe button and turn on notifications so you never miss a fascinating science update. Thanks for watching, and stay tuned for more amazing discoveries.